You're here because your doctor told you or a loved one to take medication to lower your cholesterol. Maybe you're concerned because you've heard that high cholesterol is a warning sign for heart disease. Or you've heard that cholesterol-lowering drugs like statins cause side effects, and they only control one factor that lead to disease. And that if you don't make any diet and lifestyle changes, your heart disease will progress anyway. The purpose of this course is to give you a plan of action to help you address your high blood cholesterol level. Here you'll learn about the optimal diet and how to choose the best foods to help you improve your heart health, reverse disease, and avoid relying on drugs to treat your symptoms. With a little knowledge and practice, you can create a vibrant, disease-free future and enjoy many long years ahead. There is a connection between diet and heart disease. This course was designed to help motivated people like you find a sensible way toward health. Despite the connection between diet and disease, taking pills is a common practice, but does not remedy the problem. Neil Bernard from the Physicians Committee for Responsible Medicine said, "Medications that treat isolated symptoms may not be the most effective way to treat the underlying problem." Studies show that the most powerful prescription may not lie in the pill bottle, but rather on our plates. By the end of this lesson, you'll have the knowledge and skills you need to evaluate food choices to implement a heart-healthy diet in your life. But be sure to work closely with your doctor if you're already on medication, or if you've been recommended to begin taking a cholesterol-lowering drug. Once you decide to use diet as a part of your plan toward health, as described in this course, be sure to keep them informed and seek support.